Good evening and welcome to the Kim B. Davis Show. I'm your host, Kim B. Davis. And this evening, of course, we have one of our favorite guests. We have Dr. Angela Celeste May, and we know her as the dynamic expert. Not going to read all her titles. She is our clinical, our organizational, and our forensically trained psychologist. She is president and co-founder of A.M. and Associates, Inc. She is the president and founder of Celeste Productions, Incorporated. She is the immediate past president of the Michigan Psychological Association Foundation Board. She is also an author and a musician, and you just joined the Mental Health Board as a trustee, correct?
Yes, Michigan Health Council. Yep.
Yes, you just joined the Michigan Health Council. So, all of this wonderful information, Dr. Angie, welcome and good evening. Thank you for being on our show.
Thank you so much for having me.
You're welcome. So, tonight we're going to talk about menopause and mental health. So, we had a great expert named Dr. Hinton who was on with us on our last show. And here are the symptoms of menopause. Menopause symptoms: hot flashes, vaginal dryness, night sweats, urinary urgency, difficulty sleeping, emotional changes, which include irritability, mood swings, mild depression, dry skin, dry eyes, dry mouth. I was like, goodness gracious, what's not going wrong? Racing heart, headaches, weight gain, joint and muscle aches and pain. Now, we know that menopause is the ending of the menstrual cycle for women. Dr. Hinton brought up some things that she said, patients will come in and sometimes they will be driven in because they will begin to have hot flashes. They will miss cycles. There will be a series of months that they've gone by and they're like, oh, am I in menopause? And they have questions, and we go through all of that. And we talk about whether or not they should have hormonal replacement therapy, or if they should try something over the counter, or if they should try and just hang in there and just try to navigate it as best they can. And she offers tips and tools and tricks on how to do that. But one of the things that she did say is that a lot of people will come in with their families. Their children will be with them, their husbands, their partners, their spouses. And they'll say mood changes. So I want to talk about the irritability, the moodiness, the mild depression that occurs with menopause. And Dr. Angie, because you are a clinically, forensically, and organizationally trained psychologist, is this a mental condition? Is this something simply brought on by menopause that all women should expect? Or are there certain factors that can make some people more receptive to these particular symptoms?
Excellent question. I will say that I didn't get a chance to like it because I was watching it on the fly. But I'm sorry, I said it while you were drinking. But I'll have to go back to YouTube and like it. But I did see the interview with Dr. Hinton. Fantastic.
Thank you.
Lots of excellent information. Excuse me, to your question, one thing I would say is because we're holistic beings, and it all works together. I don't think I would say is it just a mental issue. And I know what you mean, of course.
Yes.
What you're asking is, could it be a psychological or mental issue separate from what's going on in, basically our hormones are created in the endocrine system and all that. So when you have a major system of your body that's going through a major change, it's going to affect not just directly the systems that it's connected to, but it's going to, it's connected to the whole body. So that, that includes what's going on in the brain, everything, skeletal system. She talked about osteoporosis and other things that occur with lessening of estrogen and changes in progesterone hormones. Excuse me. So I would say the last part of your question, which I love, because we don't talk enough about things that we can do to mitigate.
Yes.
So that's very, very important. But let's start with the first part of your question when you were saying, are these things just psychological, just mental or physical? I would say that it's individual. It depends on the person. When someone comes in, let's say they're experiencing something psychological or mental or emotional that they're not connecting to anything physically. So they're feeling anxious or they're feeling more depressed. And so they come to see a psychologist or a counselor for the therapy side. Any, well-trained, really good clinician is going to do a couple of key things. First and foremost, of course, just as any doctor would, you start by asking what brought them in. What are the symptoms? Describe the symptoms. And then what we would do in the social sciences side, therapeutic side, is we take a psychosocial.
Okay.
So that means, psychosocial is just getting that background history, just like your medical doctor would, right? But the background history that we take, we call it a psychosocial because it's looking at all these elements of your life. So childhood, your growth through the years. We're looking not just at physical, but we're looking at your social interactions, your family of origin, your dating history, your social circles, your educational background, work history, all that stuff. All of that together with allowing them to tell their story about what brought them in and what their symptoms are begins to give you a picture. And you begin to see where the presenting present day symptoms might be connected to other aspects of their life. So as they begin to talk, and you ask questions and that picture develops, if they are talking about let's say the emotional part, the depression or the psychological things that brought them in, as they're telling their story, you'll get more information. But then, of course, we ask additional questions. Some of those key questions are things like what we call the onset. When did it begin? Can you pinpoint it? Was it connected to a specific event, a triggering event or something, it may be fully traumatic or maybe just something that's like, you just couldn't quite shake. How long has this gone on? Was it 6 months, a year? All those questions not only fill out the picture, but they are also questions that are specifically connected to how we arrive at a diagnosis. So to diagnose someone, we look at things like time frame, when did it start, how long did it last, levels of severity, all of those things. So at the end of all of that, hopefully, as you get a picture, you can begin to parse out how much of this may or may not be connected to what's happening physically, because you're asking a question about their physicality as well. So as they begin to do that, if you're getting information and asking about anything physically that's gone on, changes, etc., if they begin to describe what we call hot flashes, night sweats, or any of those other menopausal or perimenopausal symptoms you mentioned, then we might begin to think that it might be connected, but you just keep getting kind of a fuller picture. On the other hand, sometimes it can be not more difficult, but you may go a slightly different route. You would do all of that, but if someone comes in who has not been diagnosed with perimenopause or menopause, and you're getting some of that information, then you may ask, just come on out and ask them, you look at their age, of course, the woman's age, and you may ask them, have they spoken with their doctor, get that information, etc. It's like those diagrams. If yes, then you go. If no, it's a trick. So if yes, well, let's say if no, then one of the things that you may do. Let's say that you do diagnose them as having a form of depression. It doesn't have to be major depressive disorder, but yeah, a form of depression. You may, start off with an initial diagnosis of that, and still recommend that they go and see their doctor, the gynecologist, to rule that out and look and see if that might be going on. Okay. And then as you wait for them to kind of come back with that information, that helps to fill out that picture a little bit more. On the other hand, if you go this direction, if they, come in with a diagnosis already, they already know that they're in perimenopause, it's been confirmed, or that they are menopausal, then you would still ask similar questions, but you might and you would definitely ask about their circle around them, their significant others, family members. What are friends saying? Are they noticing some changes? What have they been saying to you? But also, if they know that they're in that state, then you might ask even more questions. You'd ask anyway. You dig in a little bit more into what's been going on in their life lately. Again, that last 6 months, what's going on, what's changed. If they're already in menopause and maybe they were feeling some downness, has it gotten worse? Have you noticed what times of day? So those additional questions based on their answers as you go along can help you rule out and pinpoint, exactly what we're dealing with. Menopausal induced depression or something else going on.
Okay.
I just want to just throw out the last part of your question when you were saying things to mitigate. One of the things, because I know that Dr. Hinton did talk about, hormone therapy, replacement therapy, those issues, sure. But also, again, and I know you're gonna ask about lifestyle and like exercise and nutrition. Yes. Huge difference. I know people who are like water drinkers like me. They drink their water, they do all that stuff, exercise pretty regularly, blah blah blah. They're active. And, still, there's still challenges because you are going through this change. And everybody is unique for sure. It's not just a one size fits all. But I will say that when I look at people that I know who already have a pretty good nutrition kind of routine set up with exercise and stuff, that some of these symptoms seem to not hit them quite as hard. And again, like my mom, she said she never had hot flashes. She was cold. She was cold with it. Yeah. So that's another frustrating thing, right? It's so individualized, that you never know which, or if any, I mean, there'll be something, but I do know people, like I say, who haven't been much on the water, not the best nutrition in the world, that type of thing, for whom, and this is by no means a scientific, sample that I've taken, but just in knowing people and anecdotal, information, that definitely makes a difference. And for the people that I know who weren't doing the best nutrition wise prior to, and it was, some of those things were hitting them very hard, like anxiety, etc. They were kind of like, scared into, oh my goodness, I need to, make some changes. When they did start making sure they were hydrated, making sure that they were, maintaining their nutrition, etc., a lot of those symptoms got better in the short term. Okay. I know Dr. Hinton talked about over time, but even in the short term can make a big difference.
And so you are correct, Dr. Angie. As always, you're our expert. So here are things that are said to alleviate menopausal symptoms: exercise, physical fitness, sleep, the importance of sleep, how it regulates everything in your body. It allows your body, your brain to rest so that your body can do the processing and healing from the day so that you're fresh for the next day. Mentally stimulating exercises. And I love this one because, a lot of people get older and they'll say, well, I just watch TV. Okay, there are all kinds of wonderful books behind me. I still love to read. And I tell people, read, do a crossword puzzle. I had a great grandmother who lived a very long time. She did crossword puzzles all the time. And I find them where I do word games on my phone. It helps to stimulate. And they said that those are ways that keeps your brain engaged and protects from inflammation, which leads to disease. You said healthy diet. That's right. Drink your water, guys. Yeah. This is water that I'm drinking. So it's not coffee. It does say coffee's not, but it's water. Joining support groups, talking to people, having supportive people. And my friends and I, we're starting to enter that stage where we're like, we don't talk about this. Our mothers didn't talk about this. It was always that hush, hush, whisper tone. And then when you walk in there, like, oh, you just wait till you get there. And you're like, well, wait till I get to what? Right. What is it like? How am I supposed to know? And then, of course, prescription medicine. But I want to go back to something that you said, because you talked about finding specific information on when something may have started, making sure what types of relationships that you have. Do you have the supportive networks and different things? And so one of the things that I had started the conversation with Dr. Hinton, we were talking about romantic relationships, and sexual desire is one of those things that a lot of women will say, well, my desire just left. And I'm like, did it leave? Is it possible hormonally that it can just leave? Or is that a buildup of other things, Dr. Angie? Please help us.
It could be both, either or and both. Either again, just as with anything else, because of that, those systems, and we're a holistic being. Hormones definitely affect our sexual desire and all of that, without a doubt. Having said that, there is a big piece that is emotional and psychological. And I'm so glad that you brought this out as well, because one of the things we don't talk about is the changing relationships that women have to their bodies as their bodies change.
Yes.
And this comparing ourselves to how we were, comparing oneself to, going through these different changes, that the weight, where we hold weight tends to shift as you go through menopause. And women have talked about not only psychologically feeling like not like themselves, but physically, like, whose body is this? Gaining weight easier, all the things that you mentioned and more. So downness and some anxiety or depression related to what's going on with my body. I feel like I can't control what's happening. That can contribute to feeling a little less than sexy.
Yes. Yes.
Perhaps for some, a little less. It's a feeling that doubting that you are being seen. Even if you're in a long-term, very loving, supportive relationship, doubting oneself that that I'm still seen as attractive to my partner. All of those things. That whole idea of that relationship to the you that you are continuing to grow and evolve into has a big part of that. Would never negate the hormonal impacts, because that's very real. But that other part is the part we don't talk about nearly as much. So to mitigate that, I would definitely recommend something I already mentioned. It's okay to look back over your life and look back, and I used to be a run track and blah, blah, whatever. And that's great. That part's fine. But just as we discourage people from comparing themselves to others, be careful about comparing yourself today to yourself then. If it's a trend that becomes, feeds down this depression, what I used to have, looking back all the time. And focusing forward on, like you said, learning new things, staying active. One of the misnomers of aging is this idea that growth stops, which is, of course, absolutely not true. Absolutely not true. We continue to develop new neural pathways, as we learn new things and try new things. So that's no different during the stages of perimenopause into menopause. You will likely feed a positive sense of self as you explore what, the things you can do now that maybe you couldn't do before, or because you have great knowledge of certain things. I've always been a flexible person. I'm just loving because I consciously work on increasing my flexibility, which I love, which I'm enjoying. So I got to a point in high school where I could, stand and have my palms on the floor. And so a couple of years ago, I worked back towards that. So I end every workout session. I make sure I put my palms on that floor. I can do it standing. It's like, feels so good. Like, it's so cool. And it's gotten better. It's gotten better. There's stuff I can do now, because people always also assume that declines must necessarily be physical.
Yes.
But try new things, and you may be doing, as long as you're healthy and fit enough, as long as, you got to be careful. But if you've never rollerbladed, maybe try rollerblading with those knee pads.
That's right.
Which kids, all ages, put that helmet on. I think I'd mentioned, don't know if I had mentioned scootering.
Mm-hmm.
Never been on a scooter before until last year. Love it. So like you said, try new things, explore new things. All of that feeds a healthy sense of self-esteem as well as the joy of life.
Mm-hmm.
And when you feel better about yourself, look what I'm learning. Oh my gosh, this is so cool. Let me try this. And I've got this group and we went and that also, it goes hand in hand. It tends to feed into feeling more attractive also.
Mm-hmm.
So that all of that works together. And the only other thing I'll say about that too, just real briefly is, the glass is half full.
Mm-hmm.
Makes a big difference. Makes a big difference. So even when you are going through some true, real and true challenging times,
Mm-hmm.
to look at it as, okay, what can I learn from this? It can be so frustrating because I'm not sure what's going on and all that. But as you learn, keep researching, asking questions. The more knowledge we have, the more we feel we can get a handle on some things.
Mm-hmm.
And also, everyone's different. For some people I know, there's one lady who found out that as she was going through perimenopause, what helped stop her night sweats was she had to stop eating by a certain time of night. She couldn't eat real late.
Mm-hmm.
So she was like, whenever I eat, not like any little thing, but, for the most part, stop eating by 8. And she started, let me look at it, but she never stopped digging and looking and researching elsewhere, but also like research yourself, be your own guinea pig. Let's see what works. So that was a big thing for her. She typically just backed up her dinner time to being done with everything by 7-ish, 7:30-ish.
Mm-hmm.
That got better. She, is a tea drinker, loves her hot liquids and stuff, realized that she needed to stop that around 5-ish.
Okay.
I think it was 4:35-ish. She was not hot liquids or warm liquids later into the night. Mm-hmm. That helps stop her night sweats. So that's the other thing in terms of mitigating. Find out as much as you can about just lifestyle stuff that may make a difference for you, in addition to the things we already mentioned too.
And those are great tips because those are important. Those are things that you can do on your own. Mm-hmm. I have a girlfriend who her doctor told her she couldn't have coffee. And I was like, oh, he gassed. What's wrong with the world? So she drinks decaf. I know. I'm like, oh, wait. So for everybody that's watching it, y'all, I'm so serious. I love my coffee. I love coffee. Coffee and water. Those you could hook an IV to me and I could drink coffee all day. I do not, because it's not good for you. It dehydrates you. That's However, true. Because of the caffeine in coffee, she gets headaches. That's a symptom of menopause. So she had to adjust. And these are things that you figure out. But Absolutely. One of the things that Dr. Hinton talked about, she said, for women, especially when we're talking about osteoporosis and some of these other things, and I love the example that you give where you're talking about being on your palms and how you can still do that. There are 70-year-old women that are bodybuilders.
Absolutely. 80, 90.
Yes.
Absolutely.
There's a chef, and I believe her name is Chef Babette. And she's in her 70s, she's cooking. That woman is gorgeous and she's built. And I was like, oh, I need to go sit under her. But, we can do all of those things. We just have to put the effort in. And so thank you for sharing that, if you can change your diet, make small incremental changes, those are things that can help you. The other thing that Dr. Hinton talked about, because you brought up osteoporosis, and I want to go back to that really quick. Our bones become a little bit more brittle and a little bit more fragile. But one of the things that Dr. Hinton said, weights. Do you do weightlifting, Dr. Angie? Is that something that, all right, see, I knew she was going to do that, y'all. Just showing out. She has those Michelle Obama arms.
Love it. Love my weights. Love lifting weights.
Talk about what that does for us, Dr. Angie.
It does. It one of the things that you've heard people say this, and it's terminology that's out there when they talk about not body weight, not body weight. The term just left me, but it's basically it helps to build the bone density. So a lot, exercise in general helps to build the bone density. Lifting weights helps to build the bone density. So, and actually, doing if you've never done weights before, you certainly want to start with a trainer, someone can help you make sure that you're doing it safely, that your form is correct, that you don't have injury and all of the rest. But also, people now are recommending more weights, yes, but go heavier. Go heavier. I mean, not the super heavy, but almost, but heavier than a couple of 3-pound weights. 3-pound weights you can do a lot with, but work up to it, like have a goal, work up, because you want to continue to challenge your body, your bones, the musculature, all of that stuff. And it doesn't mean, and I don't mean like go heavy, but go heavier than the lightest of weights, or gently work up to that. So yeah. And the bones, the muscles, our brains, they're all designed similarly in that, just like you were talking about with the crossword puzzles. My mom was a huge crossword puzzle person. My dad was a huge puzzle person, and my mom was a voracious, I come from reading all of that stuff. And you're so right. As you get older and into your latter years, it's you just keep discovering. It's fantastic. So just as, anytime you challenge your brain, anytime you challenge your body, skeletal, any of that, the body responds. It responds with growth. So actually, I didn't know this. I didn't know this until I taught it several years ago. I've taught, psych courses over the years in the classroom, college level. And I've taught intro to psych many times, introductory psychology and lifespan and all that. I think it was a lifespan class I was teaching a few years ago when they were talking about the time in life when your bones are most, I guess, affected in terms of, trying to mitigate osteoporosis. And I was surprised. It's like between the ages of 13 and 20. Because you're growing, so if you get like the calcium and all that you need, you get that during the development. Now we can't reach back or anything, but just for overall knowledge and what we want to tell our girls and boys, tell our girls, when mom used to say, get your calcium, drink, milk is
drink your milk.
Drink your milk. Even if it's not, we have fortified milk now. I love milk, but I do, what do I do? Flax milk and almond milk. We have other options, but they are fortified with calcium. So that's the early end of it. And then, of course, like we said, the weight bearing, that's what I was looking for. Weight bearing exercises. They do help with that for sure. And it's never too late to start. It is research has shown that if you're like 88 years old and you never exercised, and you start and you do it with some consistency at 92, you're still gonna go. Body still. So that is very important. If you have mature muscle like me, because I've been doing it a long time, and you have mature muscle, the earlier you can start and make it, find what you like to do and just incorporate that, I think the better for bone density as you get into perimenopause and menopause. So yeah.
Excellent. It does. Okay, so we talked about healthy diet, we talked about physical fitness, we talked about mentally stimulating exercises, and keep discovering. I love that. Keep learning. Let's talk about the importance of sleep. And I know I talked about it, but Dr. Angie, tell us why we need to sleep, because we live in a society and a culture that says push. Even if you got to work a grind 24 hours. And so a lot of people are entering menopause. A lot of women are entering menopause. They're still working. Some may there might be, my children are grown now. I can get back into the career world or on my career path or do whatever it is that I've always wanted to do. And now you're pushing yourself, but health challenges are coming along the way as well. Talk to us about the importance of of sleep.
So, oh my goodness, it's so important. That term circadian rhythms are circadian rhythms that we all have as human beings, men and women. we are born with that internal natural clock, we're connected to the earth. So during times pre-electricity, pre-electric light, where, it's more likely when the sun goes down, our internal body rhythms are getting ready for sleep. And that's when our internal melatonin levels start to rise, because your body's getting ready for sleep. And our bodies, if we've hopefully had a refreshing night's sleep, or we've gotten to bed, when the sun rises, our cortisol levels, I think is rising. So we are very much connected to nature, connected, it's not just some frou-frou talk. We really actually are connected to it. And as you say, in our society, in our very westernized societies, a lot of times we've gotten away from listening to our bodies and following those natural rhythms. And in doing so, just as you said, we push ourselves past the point in which our bodies are telling us, it's time to go to bed. It's time, we need to, get some rest. The good news, I think, is that at least in our American society, we're hearing more pushback against that. There's so many articles and videos about turn off your phone 2 hours before you go to bed. That whole what do they call it? Sleep hygiene, getting ready, which is, I think, very, very healthy. We need that. But if we don't listen to our bodies, number one, it's cumulative. There's a cumulative impact if you've gone, years and years and years and years of pushing yourself and not getting enough rest. Research does say that you can sort of make that up a little bit with some weekend sleeping in. You can make some of that up a little bit. But to your point, as we get into menopause, perimenopause and menopause, and we might be dealing with some night sweats, which, like Dr. Hinton said, robs us of sleep and tiredness. And we might have, that headache that's not allowing you to get rest or whatever. It becomes even more crucial to give your body what it needs to be able to function. So what happens, and you described it when you talked about that healing, that inner healing that happens with sleep. The body is actually designed to do a certain kind of restorative repair at the cellular level every hour of your sleep. Like 10, that's why I say be in bed by 10. If we can, do such things occur, but like 10 to 12, there's a stage 1 in which certain things take place, and then 12 to 2 or 3. So the body has a job to do. And if we keep disrupting it from doing its job of rest and repair, like you were saying, then the organs aren't getting what they need. Your liver is supposed to be, and kidney, they're supposed to help cleanse the blood. And so those things the negative toxins can add up. And so of course that's never good. Also, one of the symptoms of perimenopause and menopause that people talk about is that brain fog.
Yes.
That kind of fog, just like, not clear-headed. Some of that can be attached to more difficulty with sleeping, for sure, for sure. So again, it all works hand in hand. If you are having some brain fog because of just all the changes and hormonal changes and things that are going on within your body, and then you're not getting enough sleep. And we know that you can be foggy, not getting enough sleep, at 15,
Yes.
These kids that kind of drag into school because why are you up all night? Let alone, at this stage when your body's got all these other challenges. So sleep makes a big, big difference. And just like with everything else, it can help ease some of this and mitigate some of this. Yeah. Or a lot of it, for sure. Yeah, makes a big, big difference. And I was gonna say also, from muscular repair to what's going on with your bones, all of these things we're talking about, sleep helps that. Good, healthy sleep helps that. You can sleep too much. That's a possibility too, but getting adequate, and the key is restorative sleep, restful sleep makes a huge difference.
I agree with you, because nights when my sleep is interrupted for whatever reason, whether it's a small child, there's an emergency, my phone rings, or something happens, I am feeling funky the next day. I'm not at my best. I struggle. Like, I'll say, you know what? I can't think of what word I'm trying to say because I'm tired right now. It's not coming to me. And my friends are like, you need sleep because that's not you. I'm like, yep, I need my sleep. And then I'll get my sleep and then I'll remember all the things that I was struggling trying to remember.
Right.
It's very, it's very, very true. Go ahead.
Yeah. I was going to say, what you said just now also brought something back that I was going to mention as well. Kind of going hand in hand with what Dr. Hinton and you all were discussing, this idea of being careful not to make everything menopause that you know that you're going through. When you were saying that about having not getting enough sleep and then foggy brain and everything, it's also I have this thing because just the way I was raised, don't call everything, oh, I'm just older,
right.
I'm just older. Some things change, some things may not be as easy, maybe your knees are you can't quite do the jumping as much as you used to. That there's a huge difference between that and then just go and sit on the couch.
Right.
You can still get out there, walk, try new things, whatever the case. So by the same token, menopause is its own set of stuff that goes on. Unhealthy living creates its own sets of damages at any stage of life. If you have unhealthy living together with menopause and perimenopause, it's going to be like, an extra. So I had mentioned before, learning new things and that glass half full concept, that mentality. I also know women who really use perimenopausal symptoms or menopausal symptoms to make some changes that they needed to make anyway. It's just, it becomes harder to get away with robbing your body of the rest that you need. And we say, oh, I'm getting old. That's a good thing because you need to not, you're hurting yourself anyway. So get up and take a walk. Yes, lift a weight. This is something that is good for you anyway. So there are opportunities.
Absolutely, there are. And I'm so glad that you brought that up. A friend of mine, I remember when you mentioned cold flashes, a girlfriend of mine told me that. I said, there's cold flashes. She said, yeah.
I never heard the terminology, cold flash. I love cold flashes. Okay.
And she said, that's a bone chilling cold. And she said, no matter what she would do, she could never get warm. She never had hot flashes. She just had cold flashes. So one of the things that she did, she would have a heating pad, for her bed, have extra covers, things like that, so that she could. But then she said, then, you get a little warm and all of that's got to come off. So you got to be flexible in what you decide to do. If you specifically have hot flashes, buy a cooling pad for your bed. It does help. They've got all kinds of tools that they didn't have when our grandparents were going through it, where they would just get up in the middle of the night, just fanning like, whoo, I'm having a moment. And we had started this conversation because my girlfriend, we were talking and she was having a moment while she was on her train commute in the morning on her way to work. So she's got on makeup, her hair is done, she's in a suit with heels, and all of a sudden she had a moment and she's like, whew, do I take all my clothes off? Because that's what I felt like. I said, girl, they'd have been on the train and said, oh, this lady, she up here stripping, she trying to do a show. Or somebody else would have said, oh, she having a mental moment. Call the people. But, for women,
layers.
Yes, layers.
Layers are, layer it.
Yep. Layers are your friend. Layers are your friend.
They're your friend.
And like you said earlier, figure out what works for you and what doesn't. Continue to read. The information and the research is ongoing. Dr. Hinton scared me because she said your hot flashes could go into your 70s. And I went, oh, I thought it was just 10 years. She says, no, some people have it a little bit longer. I said, oh, I didn't know that. Oh, goodness gracious. So I'm just telling you, that some things can extend, but she did say that, the women that have hot flashes well into their 70s, it's not that often, it's not that frequent, and they have learned to deal with it, and it's a brief moment. As you said, each and every person is unique and different, so find what works for you.
Absolutely.
And keep discovering.
Yes. So important.
It is.
It is, yeah.
Dr. Angie, remind us why we need to keep that glass half full.
The joie de vivre, the joy of life. We need to keep that glass half full, or keep seeing it as half full, because it helps us keep living. It helps us keep moving forward. And we're not isolated. So there are people, even if you feel you're alone, you're influencing someone, you affect someone. We have people who love us, people who we care about. So we're moving forward, not just for ourselves, but for all of those that we're carrying with us, not to make you feel, burdened, but we a lot of times we know that we give a lot. We're not sure if who sees it or appreciates it, but you are seen, and your continuing to keep going motivates not just yourself, but other people. It makes your quality of life so much better. And if you see the glass as half full, you'll keep wanting to discover things, because it's fun. It feels good. It feels good. It's fun. And it's amazing how if you have that mindset, it doesn't matter how old you get, you keep discovering new things about what you can do, who you are, things that are in the world. It's just, it's just endless. It's endless, and it can be a lot of fun and a lot of joy. And we're only here for about 3 or 4 minutes, so we might as well, tap into, all the positive things that life has to offer. And then also, you don't have to be menopausal, in the latter stages of life, at all ages. It's so important we talk about giving back and sharing and all of that. How much more so as you've gathered these pearls, of aging, that you get to use those things to share. And if you have a glass, what I've noticed about people with a glass half full kind of mentality, I'm thinking of a perfect example is my sororities. So my Alpha Kappa, my sorority, but any of those, such organization, because what's really cool is that I have sorority sisters from 102, 104, whom we always honor our elders, there are jewels, from 18 to, and we all learn from each other. Right. So what's so cool in that organization, one of the things that's so cool is you could be brand new. There was a new line of sisters that just came into our chapter. Yes. 141, 140, so many. And what's so wonderful is you could be in this, these organizations, the Divine Nine, the Black sororities, fraternities, you could be 65 and brand new to the organization. So it's like, oh, wow, new things to learn. And you're learning all kinds of wonderful things from that 26-year-old. So you're teaching and you're learning. When you have a glass half full, you're learning from, you're open to learning from children, as well as giving. And so it just makes your life fuller and richer, so I know a lot of times people will say, I've got to make myself happy, to be here, be here in life and everything. And definitely being happy is so important. It definitely is. But we also know that struggle is part of life. And some of our most, everyone is important. Everyone is a treasure. I was just going to say, but some of our most treasured people who have sacrificed and given for their community, for the world, for their family, whatever, their first priority was not to make themselves happy, but to really walk in their purpose and discover what that is, and do in that process, there is joy. Right. So it's not all, from my personal perspective, it's not all about just go be happy, go be joyful, be happy, but also as you seek and find your purpose, there's joy that comes from that. And there are folks who are finding their purpose for the first time post-menopause. More power to you. It's wonderful. And it's all a part of that person's journey. So glass half full, glass half full, glass half full. It's a wonderful thing.
That is a great way to end our podcast today. Thank you, Dr. Angie, for coming on and helping us learn more about menopause and our mental health. Now, tell us where we can find you. Tell us all the exciting things that you have going on with your book, with your music, with your coaching group, your practice, everything.
Okay. Well, let's see. I am, I just, like I mentioned, I'm a classroom university professor. I teach psychology and all that good stuff. So I usually teach college, everything from associate's level, undergrad, all the way to doctoral level. A couple of times I taught some high school kids. So I just taught some high schoolers in early college. So love teaching the babies as well. So I just wound that down. So yeah, I continue to be a college professor at Wayne County Community College District. On the psychology side of what I do. Of course, I'm president and co-founder of A.M. May and Associates Incorporated with my sister, Michelle May. So she's a licensed counselor. And I'm on the psychology side, and we do counseling, consulting, and coaching. So at this time, she is offering therapy in our company. I personally am not practicing at this time. I have done therapy for a number of years in the past, but I'm more so the consultant, and both of us do coaching. So we have ongoing personal, professional, and doctoral and creative coaching as well. And we are winding down our women's coaching group right now. So we have a Power Women's coaching group, and we do it twice a year. It lasts for about what do we do? 8 weeks, and we meet every other week or so. So we will be starting up again in October, mid-October, I think October 10th. We meet by Zoom on Mondays, every other Monday. So we will start advertising and marketing for that in several weeks, over the summer. So keep an eye out for that. Go to amaassociates.com for our website. On the socials, you can find our company at on Instagram, excuse me, on Instagram, on Facebook. Facebook at AMA Associates, just keep looking for that name, amassociates.com. So that's the socials. What else psychology wise? I think that's it for the moment.
What about your male coaching group? How's that? Or is that
thank you for asking that. Yes. My male coaching group, I love it. This has been on my heart for a while, and I wanted to do it, and I was able to. And that is the stress management coaching group for Black men specifically. I did that in February, and I was going to do it in May, but I need to push that back because of other projects and stuff I'm working on right now that shall not be named at this moment. So I plan to do it in the fall. I plan to do it again in the fall. So again, you can go to those same places and look out for information for that. For that one, that is like I said, it's a men's coaching, stress management coaching group specifically for Black men. What I love about it is we know that there are unique stressors for Black folks, and particularly for Black men, just like there are particularly for Black women. But being men in general of any background, in our societies, we don't impress upon boys and men healthy ways to express their emotions, deal with stress and all that. So the stress management group for Black men, it's a coaching group, 4 weeks. We meet once a week, and we basically go through the different aspects of dealing with stress mentally, psychologically, physically, all that. What's wonderful about it is it really, the way that I do it, it really teaches them how to be more self-aware. So it's very targeted to the way that they cope, and they come out of it with a lot of new insight into how they cope, the things that they tend to do that may be healthy, not healthy, and you can work with some. It's wonderful. I'm excited to have been able to do it. It was very impactful. I did it in February, so I'll be doing it again in the fall, and hopefully I'll be doing that like 2 to 3 times a year. Continue forward. for my book, Freedom. What is the experience? I just threw my earphones. What is the experience of living without negative self-imposed limit? There it is, limitations. There it is. You can find this at on Amazon. This is the soft cover. There's the hardcover as well. And it's basically, it's research that I did with people from different backgrounds, different ages, talking about how they went from being stuck in some aspect or area of their life all the way through to getting free from that and the things that they learned about it. So it's a wonderful tool that is very applicable, I think, for people from nearly at any walk of life, that you can find some lessons in there to apply. There were 7 key themes that came out of the research that was very, very helpful for people in their growth. So that is the book. Like Amazon, Ex Libris, it can also be found. And then for the music side of what I do, you can go to YouTube. Everywhere my name is Angela Celeste May. So like it says on, there you go. Like it says on
there you go.
there it is. So YouTube is primarily my channel for music. I do a lot of like tutorials on music, and I'm a vocalist primarily. I'm also an instrumentalist and a music educator. So I have vocal quick tips and just lots of information about music and learning about musical genres and things like that. You can get my 2 albums from Reverb Nation. That's REVERB NATION / Angela Celeste May. So you can go to my site there and look, listen to my albums and purchase the singles, etc. You also can find my CD Reintroducing the Lady on Amazon and other places out there. What else? Oh, and of course, all my personal, Facebook, Instagram is Angela Celeste May, and Twitter, and my music Facebook is Dr. Angela Celeste May. So I'm out there doing all kinds of cool stuff. I'm continuing to write. As mentioned when I was on before, I had been writing, so I am writing some more. As soon as this project is done that I'm working on at the end of June, hopefully I'll be able to do more musically. I teach music right now as well. Okay. So if anyone wants to contact me, they can at Celeste MUS and the number 1. So that's CELESTE MUS the number 1 at AOL.com. Good old-fashioned AOL, if you're interested in lessons here in the Metro Detroit area for my music studio. And I teach piano virtually also. So that's some of the stuff I've got going on right.
Excellent. We love it because you are always so full of information, and you always do have a lot going on. So I hope that people will sign up with you and get their creative self going on. Thank you, Dr. Angie, for joining us this month. We know that next month you'll have another exciting topic for us, and we can't wait to sit down and talk with you again. Thank you for being on the show.
Thank you.
All right, guys, this has been a great show. You know that you can always find me on Snapchat, TikTok, Instagram, Facebook, Twitter, LinkedIn, everywhere on social media, and it's Kimberly Batchelor Davis. Bachelor is spelled BATCHELOR. You can see this show on youtube.com/ Kimberly Batchelor Davis. You can hear this show on Apple, Spotify, Stitcher, Google, and Wisdom. You can also learn more about me as an author at kimbdavis.com. Thank you again for tuning in. And as always, remember, be magnificent.